Hope you've all had amazing Diwali celebrations, and we're all set to know more about palliative care. A warm welcome to Ms. Arathy Venukumar. So far we have been getting knowledge on what is palliative care, how to do with it, and how, in fact, we have seen into nearly most of the important issues concerned with palliative care. Next goal of ours is to know how to set it up and run it efficiently. That is the important thing. We need to know to set it up and also run efficiently. That's where the importance lies. And for us to be successful in that front also, we have got someone who is an expert in that field. Ms. Arathy Venukumar has been a national coordinator for Palliative India, and she's got a good solid experience of 10 years of human resources management. And and her main interests are human resource management, palliative care, and project management. So our project next is to go into setting up and getting into palliative care and providing efficient service. So the floor is yours, Ms. Arathy Venukumar, to enlighten us to be sufficient and efficient in it.
Thank you so much, ma'am. Okay, so good evening, everyone. As introduced, I am Arathy. I work as National Coordinator with State Facilitation Division at Palliative India. I act as coordinator between Palliative India and regional coordinators across India. Let me brief a little about state facilitation. We as a division try to take the work that Palliative India does to various regions in India with a vision to facilitate access to palliative care to all those who are in need. Details will follow in the later slides. This session, as ma'am already mentioned, it will brief you how you can open a palliative care center in your region. You may be already part of hospitals or individually you will have some clinics. We shall guide you on how to start a palliative care service in your setting. Please feel free to clarify queries. We'll be happy to help. You can either raise your hands or put your queries in the chat box. So once I complete the session or in between if needed, we can discuss the topic, queries. So we'll start with this WHO Palliative Care Advocacy Triangle. As per WHO, to set up a palliative care center or organize palliative care services, we need to ensure three things like education. So we'll move one by one. Under education, there are barriers to palliative care which we'll have to overcome through education, like what we are doing right now. So there are 3 points that comes every time in front of us, like lack of awareness among the professionals, lack of awareness among the administrators, lack of awareness among the public. So it is essential to educate the public. The public demand does persuade the professionals and the administrators to think. That's what we feel, from our experience. Next thing that we need to know is drug availability. Pain relief is the integral part in palliative care, and for that, availability and accessibility of pain relief drugs is necessary. Morphine is the mainstay of pain management, and its availability has been eased to a small extent by the amendment of NDPS Act in 2014, but most of the states are yet to implement them. So that is one. And the third point is policy and its implementation. In much of the world, palliative care came into being because of individual initiatives and action by non-government organizations. However, to achieve national coverage, palliative care needs to be integrated into the general healthcare delivery system. So the government action is also needed to remove barriers to access to pain relievers. It is essential for budding services like us or like you people to develop their own policies, and this will help to overcome any gaps in the available facilities. When we plan to organize a palliative care service, do well to remember that you should be trained, you should have opioids available, and there should be a policy or a program available to support your services. So that's how this triangle helps us. Next, moving on next. This is now here, I'll be briefing you about organizing palliative care services in Indian context. That's what we'll be learning today. In Indian context, as you have, you can see in the slides, we have three major categories: standalone, a department or a unit within a hospital, and community-based home care. So we'll go one by one. In a no, keep it that slide. Okay, so in a standalone a standalone model is an independent facility where we provide palliative care with specific focus on pain and symptom management and improving quality of life. That quality of life, improving quality of life for patients as well as their caregivers, mostly families. This can be done through a hospice or a palliative care center. So that's what a standalone model is. Now coming to the department, a department within a hospital, there will be a dedicated department or a palliative care attached to an established hospital. That's what is meant here, which might be a government hospital, a charitable, sustainable model, or a for-profit model. Now coming to the third part, community-based home care. This is where the community gets involved. Here we reach to the care receiver where they are. That's what the community model tries to explain. Here comes the social capital, which act as a bridge between the micro and the macro element. So the major element in community-based home care is the social capital, and the social capital here will be volunteers. We'll explain you in detail in more, when we move further. So I don't want to repeat the same thing again and again. So we'll tell you in brief when we move further. So these are small. Now we'll go to some examples that we have catalyzed or we work with. Are like standalone centers will be Cipla in Pune, Roma Vedana in Kolkata, and PGI Chandigarh. These are the examples. There are many, but these are the examples that for standalone hospices. Next is a department within a hospital. This is an example where a palliative care unit is run within an established hospital. This is a government hospital in Arunachal Pradesh. And the third category through which palliative care delivery is done is that I already mentioned this community-based home care. So now the difference between a regular home care service and a community model is the model of delivery. In Indian context, the macro components, which here will be the tertiary healthcare institutions, those are getting bigger and bigger, and the micro element, that is the beneficiary, is not able to reach them. So this is where the community concept comes into action, which we call as meso component. So they take the ownership. This is what the what to tell. This was the beauty of community model, is that the meso component takes the ownership of bringing micro and the macro components together. That is bridging the gap between them. That's how this community model works. Now in Kerala state, the Kerala state has utilized the power of community model, which might not work in the setting where you belong to, but we would like to take this, bring it to you as an example or a prototype with which you can get an idea on how you can go forward and set up a service like this. Now, so this is the Kerala palliative care model. Next, as we go forward, this is, his name is K.R. Nair. We call him Nair uncle. I would like to share his story. He's a 70-year-old man. He used to work with the in the army. He was introduced to us through his wife was our beneficiary, and he was the caregiver for her. So when she passed away in 2004, from 2004 onwards, he is with us as a volunteer. So now, what his responsibility? No, that is, we didn't give anything in writing that these are your responsibility. You have to do these things. No, he took the responsibility as his own. He took the ownership, and he used to go with our home care team. So daily we have 5 to 6 teams going out in the community serving the people. So in one of the home care team, he also used to be a member. He was the person who knew about the patient well than the team of doctors or nurses, whoever goes with the team. No, he knew everything about the patient. So the patient would call him first, rather calling our team. So that was the rapport he maintained with our patients. He wasn't given any such responsibilities. He took it for, by himself. So that's what is written here. Volunteer is a person who actively takes on task, responsibility, and project for her own accord. We are nothing needs to be assigned or ordered or told. He wasn't told to do these things. He did it for himself. He's currently also he is with us as a volunteer by his own, no without expecting any remuneration or nothing. So his satisfaction is satisfying the need of patients that he sees every day. Now, moving to the crux of the section, how to organize a palliative care service. This is something that we have designed. It's not it's not the flow that should be followed. It's just a flow that needs to be a checklist that you need to have with you. So we have made a 10-step approach. And you can modify it based on your settings. First, of course, is the arranging of funds. Before starting to organize the whole program, we need to think where we can arrange funds from. If you are part of an government hospital, there are funds available through national programs like NPPC, Ayushman Bharat, etc. For private, of course, you can sell your services and get funds. For charitable and individuals, the actual challenges for them, either you can go for CSR or for public donations. So you should have an idea of where you will source funds from when you go to start, when you plan to start organize a center or plan to start a palliative care unit. Another thing that you would need is a team. A basic unit will consist of a doctor, a nurse, and a social officer. Okay. So you'll have, initially you need only these 3 people, a doctor, a nurse, and a social worker. Going forward, as you grow, you may require allied medical professionals like pharmacists, physiotherapists, occupational therapists, dietitians, etc. As a basic unit, you will just need a doctor, nurse, and a social officer who should be trained in palliative care. So you have to ensure that they are trained. Like I told earlier, when WHO triangle, you have to ensure that education is there. So you have to ensure that you have a trained team while you start a palliative care service. The next thing that you would need is an infrastructure. So it can be a room for an OP, or a space and furniture for beds and all for inpatient unit. And in case of home care, a vehicle which can be used to travel to the needy with all essential essentials like medicines and other consumables. Next thing that you would need to arrange is opioids. So, along with education, you need to ensure that you have drugs available. You have the availability of drugs with you to ensure that to procure, store, and dispense opioids. You need to be a part of recognized medical institution. Um, it's a lot of information required for understanding this topic. You will have the undergone opioid availability? No, no. So you'll have a session on opioid availability. So there you will get a idea of the whole session will be dedicated to how to procure, how to store and dispense opioids. So that's a lot of information. Entire session would need that. So I won't get into that right now. You'll have a detailed session. Next, you will need is to establish connects. So you'll need to establish connects with the existing experts in palliative care in your region. This will help you to understand the local challenges and support that is available in the local region. Next is to create awareness. So for the public as well as for your team. If you are already part of an hospital where you want to start a palliative care unit, then you will have to educate or create awareness for your team there, for your hospital, so that you will, through that you will get referrals, and by creating awareness, you can identify local champions who can take your work to more people. So that awareness will help you for that. Now, developing an OP, coming to the infrastructure part again, developing an OP, or for that, maybe you will, you can hire or rent, sorry, not hire, you can rent a local hall or a classrooms of schools, colleges, or a room in your, if you are part of an established hospital, you just need a room to conduct an OP. Just ensure that all the facilities that you are looking for are, or you find should be disabled friendly. You can in that room you can just have an examination table, a chair, some basic furniture, and a locker, something like that, to store your drugs and opioids, and other medical equipments that you might need for operating in an outpatient unit. Developing the IP facility will involve a little more infrastructure in terms of beds for patients, side lockers, etc. You might know better than me what all things are involved in developing an inpatient unit, a small hospital clinic type infrastructure. Now, for home care, as I said earlier, you can start with one vehicle which can accommodate the basic unit, that is a doctor, nurse, and a social officer, and medicine and consumables that can be accommodated in the vehicle. Now there are scenarios where just a doctor or a nurse go on a two-wheeler for home care. So it's just a passion that drives. So if you have passion to serve the needy, you can go have a scooter, a bag, and go for home care. You don't need a nurse, a social officer, or anybody. You can just be one man army for serving the needy. So there are scenarios like that. We haven't faced such kind of. We have we know people like that. So now, as I have already mentioned about the volunteer involvement, who a volunteer, like what a volunteer should be like. So you have to find in community when you go for awareness. You can you will identify people who are who have that spark while conducting the awareness. Like what we do here is when we create awareness, conduct awareness sessions in the community, we get the spark from the people who are like, yeah, I want to do something for the community. Get hold of them, and they will be your local champions for, for further process, like for the development of your palliative care center. Any doubts till now? It's a total theoretical session. I might bore you all. So if you have any doubts, you can, I'll stop here and take your questions till now, if you have any questions.
Can any doctor with a palliative course, what we are doing is being certified, is authorized to start with registration from the state or the region or Chennai, whatever it is?
Okay, where are you based out? Like, are you which
No.
state?
I'm in Chennai, ma'am, but I'm the chief medical officer and Atulya senior care. But we are to start a palliative wing in that.
Mm-hmm.
So how are we to go about now?
In Kerala, FCPM is also considered to be the certificate course for, procuring opioids. I am not sure if that is, I don't think that is considered as a, point
No,
in sorry, sir?
In Tamil Nadu also, see, like
Yeah.
there is, hello dear, I am Dr. Radha speaking.
Yeah,
In
ma'am.
Tamil Nadu also, what they say is, FCPM course is certified. Along with that, there used to be, what I'm telling is like couple of years ago information, he can double check. Along with this course, there used to be some like 10-day involvement of some number of cases, and adding on that information also together. So if you do both, you could get morphine, and then that could, because getting morphine is the important thing, as you mentioned, to start a center. So for morphine, I remember that was another requirement. You need the course, and then there used to be, along with the course, another element
hands-on training,
which had in, pardon me?
You should be, you should have done 5 days of hands-on training.
Correct. Exactly. That one, both together will give you, because that hands-on training will involve case, and then you present, you deal with the case, something like a small write-up or presentation
Like
type
workshop.
of thing.
Okay.
Pardon me?
Like a workshop.
A workshop, exactly. So that both together was essential to get license to get morphine. So because that is essential, doctor, to start a center. So this is what is my information for Chennai. So you can double check, and I think that will still hold good, but you have to double check. What I'm telling is 2020 information. So you have to double check with that, and then you should move forward with that. That's the update information that I know for Tamil Nadu state.
Okay, ma'am. Thank you, ma'am.
Thank you, ma'am, for that information.
She will, like other, will you be able to see? Don't think it will never be boring, dear, because we are not used to management information. So we need someone to guide us. Okay. So will you still be able to, if he gets all the information, for example, as I said, he gets what is needed to get morphine, and then where and how he goes about, will you be able to help him?
Sure, ma'am. That's what we do. Like,
yes, there you go.
That will
Dr.
come in
Umapati.
the late, like, I'm getting into it. I'm getting into it. So whatever facilitation a team, a person needs to start a palliative care center, we are there to help them. So I'm coming into that.
Okay.
Yeah. Okay. We'll go forward. Any other questions? Okay. So this is where your answer comes in, ma'am. Now we will look into how we'll support or facilitate the palliative care service, which we have discussed here, like for, the various models like government, for-profit, sustainable and charitable. I think we are working with Atulya Living also for developing a palliative care center. So we are already in touch with the team from where Dr. Umapati was talking. Yeah.
Yeah. Yes,
Yeah.
ma'am.
Yeah. So I'll move forward. We have 4 things that we support. Capacity building is the one of the major support that we are providing. So we'll be helping in conducting workshops, orientation programs, foundation trainings like this, what is happening right now for doctors, nurses, health workers, training of the faculty for UG curriculum, training and engagement of volunteers and community, specialized trainings like Pali-COVID, for palliative care training for physiotherapists, pulmonologists. In government, we support training in, we support in training the CHOs, ASHA workers, ANMs, etc. Next thing that we support is the for opioid availability. We support in getting the NDPS Act implemented. That I had already, if you remember, the NDPS Act was, came into action, but it is not implemented. The law came in, the act came in, but it is not implemented in most of the states. So we create awareness in medical institutes, about the new RMI process. Sorry. Okay. We create awareness to the medical institutions about the new RMI process with the state drug controller. We try working with the NHM to get the opioids included in the state essential drug list. So that's what we do for, likewise, we support the access of opioids for our stakeholders. We do handholding for palliative care units at district level, connecting palliative care, local palliative care networks. We provide documentation and assistance, documentation support also. Developing program implementation plan for state implementation of NPPC, development of palliative care through health and wellness centers under Ayushman Bharat scheme. Palliative contributes towards developing a state palliative care policy. We do have regular connects with Ministry of Health and Family Welfare for developing palliative care in states. So we have a person sitting in Delhi who works to develop policies on palliative care. Works with the central government to bring in policies for palliative care. We help in recruiting human resources for starting a palliative care center. We facilitate the cost management and sustainability. We help build funds through donations and help in grants and CSR applications. So, like I was telling, that arranging funds is the first point that you should keep in your mind while starting a palliative care service. We help in finding grants for you, and if you are trying to apply for a CSR, we do help you in applying for that. So for any that kind of support, you can get back to us for supporting you. We have a new process called implementation team support. This is in this process, we send an implementation team of doctor, nurse, and a coordinator to your site. We'll stay with you, handhold your team through the process of setting up a palliative care service for a given period of time. That's what happens in the implementation. And then thereafter, we'll have monitoring and evaluation schemes for that. Next major thing that comes into our minds while working, while setting up a palliative care services, challenges in the sectors. All the sectors that we were talking about, like government, self-sustained, like sustainable model, profit and charitable. So these are the challenges that we have come across while working with the or with all these sectors. Main thing is availability of funds. Even though they have schemes and all, the funds are limited for palliative care. Few of them want to play safe with the, when you learn, when you go through the session for opioid availability, you'll see what all legal things you need to ensure to, when you are dealing with opioids. So some people don't want to get into trouble, but the thing that you can you need to keep in mind is if you are ensuring that the documentation that you do is perfect, there is a certain process to follow while you keep keep opioids with you. So if you are following that, you need not to worry about the legal things in it. So, but people are like, no, I don't want to enter into such nuances. I don't want to, you know, I don't want to break my head there. So I'm okay. I don't want palliative care. So then inadequate knowledge in palliative care, the amendments, the laws, like even if the NDPS Act has come in, nobody is aware of it. So we go and tell them that this is what the amendment is. You can, it is not the old procedure that is being followed. This is the new thing that has come. You can, it is more easier now. That's wherein our role comes in. Like we, as a state facilitation team of Pallium India, go and talk to them that these are the things that have come in. Please go through and do the needful. So there is inadequate knowledge about palliative care everywhere. Of course, it is not a, trained human resources are not available and not a very lucrative business. Palliative care is not considered to be a lucrative business. And mindset of certain people that it's a lost cause, no treatment or saving of life is involved in palliative care. That's also the thought that has come across. And when we go, and others are in government, the major challenge that we face is transfer of trained people. So we train them, for if it's online training, it's 1.5 months, and for same with the on-site training. Once the person is trained, the person get transferred. So then again, the whole process has to be started. And there, not in every sector, I think we come across the hierarchical issues, conflicts between the interdepartmental and hierarchical approvals. So we have come across that also. So you might face these all challenges when you go and open up a center. So this is what we have faced. You might be facing new things, but we are there to help you to get out of all these challenges. We have come out of, or even though these challenges were there, we have catalyzed many centers. We will see how many centers, like we have catalyzed 72 centers even after these challenges. All these years, all these years we have catalyzed 72 centers, 72 palliative care centers across India. Next, we'll see the standard audit tool. This is kind of a self-evaluation audit tool for palliative care centers to know where they are standing. There are two parts of this. Part A is essential, and part B is desirable. Essential is the minimum requirement that a center should abide to, and the ones listed in the desirable are regular requirements. There is a link of the original document in this PPT itself. This PPT will be shared by the training team with you. The training team will share this with you. So you can click on the link and get access to the tool. So if we are starting a palliative care center, this tool will help you to understand where you are standing. Now we'll move on to the Pallium India model. The Pallium India model, we call it as a DEF model: demonstrate, educate, and facilitate. We'll go one by one. In demonstration, it's a proof model that we take, that we take to our stakeholders, so that the potential stakeholders like, potential stakeholders like you learn how to deliver palliative care. So here we have TIPS, that is Trivandrum Institute of Palliative Sciences, um, which is also a WHO collaborating center for training and policy for access to pain relief. So we'll go through the demonstration model first. So here in TIPS, we have inpatient care, outpatient unit. We have an outpatient unit at Pallium India, as well as with other government hospitals and other link centers. So let me brief you about the link center model that we have here. Like I told you before, we create awareness and we find a person with a spark. So when we go into the community and deliver awareness session, we get people from community, like the people who are interested to work towards this novel cause. They come to us asking how we can help. So these people, there will be a group of people. These people will be coming together, and they'll form a group. They'll find people who are in need of palliative care in their region. So for example, in Trivandrum, we have 14 link centers. So we have 14 group of people who have come together and formed a group. This will be a simple palliative care unit. They will have their own doctor, nurse, social officer, whoever can run a palliative care service. They will refer patients from their community to us. They'll take the ownership of taking care of the family or the patient, whoever is in their area, and take palliative care to them. That's how we learned about the meso component. No, they act as a bridge between the tertiary unit and the beneficiary. So now, initially, we'll be supporting them with resources, all kinds of resources: doctors, nurses, medicines, consumables, everything. Now they will start, developing themselves. So they'll work towards sustaining themselves. So when we feel that they are self-sustained enough to run the center, we'll withdraw our support. We'll withdraw the support of doctor, nurse, whatever support we were giving to them. They'll then run the center by themselves. That's what the link center model is. So likewise, we have 14 link centers in and around Trivandrum, 87 volunteers. They are not paid. 87 volunteers are there in total who are working to, in their community and serving the people there, taking palliative care to them. We have, like I said, our OP in these link centers. We have OP in government hospitals, Trivandrum Medical College, General Hospital, and pediatric palliative care we have in one of the hospitals here, Mother and Child Hospital here, a government hospital. So we have pediatric palliative care running there. We have home care in all these link centers. Till now, we have 3 to 4 link centers which have become self-sustained by these years. Then we do rehabilitation and reintegration for the patients. We have, like I told, we have community participation, the link centers. Next, we have halfway home. This is a project which was initially funded by Social Justice Department of Government of Kerala. Now, that was a 3-year project, and after that, we continued running that project. So in that project, we actually look into rehabilitating patients who are paraplegic. So these patients are admitted here. They are trained on how to live their life independently on wheelchair. So we provide physiotherapy, we provide, training on how to transfer themselves from wheelchair to bed and vice versa. We help them go to, train, we train them how to move around in their house independently without support from their caregiver. Then we help them with vocational rehabilitation also. We train them in certain, jewelry making, umbrella making, soap making, whatever things that they are interested, which is, feasible for their situation, and whichever they can do for long term. So we help them train and train in that also. And when they get discharged from here, like the facilities that they were availing here, they might not get it their home. So their home might not be disabled friendly. So we'll take the help of the community volunteers there and make their house disabled friendly. So we have created ramps for them. We have widened the doors for them. We have, put in rails in their washrooms and all, so that they can go inside independently and, roam around in their house without any restrictions, without any hindrance or, barriers, and barrier-free environment. That's what we create for them. And it's not Palliative India going and doing everything for them. It's the community volunteers who come together and help them lead the life. So that's a ownership taken by the community. So till date, we have seen 22,000 plus patients. Now it's 22 till date. And as I told, we have 14 link centers and 18 volunteers through community engagement. This is what the demonstration model is. Coming to the education, before that, we have national helpline. It's called telehealth. So here we have, we get two kinds, we address two kinds of beneficiaries. One is palliative care doctors across India who need advice on palliative care. They call us and we get calls from palliative care beneficiaries also. So we get calls from patients and we get calls from doctors. So that's what this number is. The languages that are available are Malayalam, English, Tamil, and Hindi. You can note down these numbers. So for anybody who need assistance in palliative care, we are there to help you through this number. So we do, if we are not able to go and see the patients, we go, we do video calls also. So that we have a team of doctor and a nurse sitting here at Palliative India and working on this service, palliative care telehealth service. Now coming to the educate model. So in educate, as we are doing this, this is the education part running right now. We train peoples in the sense, doctors, we train doctors, nurses, allied medical professionals, volunteers, student volunteers. We have palliative care beneficiaries who, sharing their experience, coming on the same platform and sharing their experience. That's called Arohan. We have specialized uh, programs also. That is refresher course in palliative medicine. So once you are done with FCPM course, you'll, and you have experience in palliative care, the next thing that you will be wanting is a refresher of the course. So you can have that course as well. So our training team will be updating on you on, updating these details on the groups. So you can, if you want to attend those sessions also, you are welcome. Next, coming to the state facilitate model, there comes in the role of state facilitation division. Now, the philosophy of state facilitation divisions is to integrate palliative care in all the 3 levels of healthcare, that is primary, secondary, and tertiary. As I mentioned earlier that we have regional coordinators across India. So we have regional coordinators in 4 regions. North, we have Rajendra. He is based in Uttarakhand and looks after the northern region. Northeast, we have Rontu Sangma. He is based in Guwahati and looks after the northeastern part, specifically the 7 Sisters and West Bengal. This is how we divided the whole India for, based on the availability of the regional coordinators. So those who are, those who in this, there are 29 participants in this forum. So anybody who belongs to these states, the first point of contact for you will be, for North people will be Rajendra. For Northeast, it will be Ron. We call him Ron. Full name is Ron to Sangma. Coming to the central part, we have Sunanda. And in the South, it's me. So, so whatever query you have, you can get in touch with these regional coordinators for, you'll be dealing with these people. So your first point of contact will be these 4 people. And we are headed by Shalini. So Shalini is the head of state facilitation division. So we are 5 member right now. We'll be sharing the contact details of all our coordinators through the chat books. Our training team will be doing it. You can get in touch with them for any, like I said, for any regional specific queries or facilitation, you can get in touch with them. So coming to the 5 objectives of palliative care division, these are the 5 objectives. First one is catalyzing palliative care centers and services. We help in end-to-end facilitation for catalyzing services across all categories, government, charitable, sustainable, and non-profit. We assist in opioid accessibility by facilitating in getting the RMI certificate. There is a long procedure involved in that, like I told you. We'll help our stakeholders to go through each documentation, like filling out applications, talking to the drug controller, maintaining the records, etc. We enable palliative care palliative care training in medical institutes. As we know that education plays a major role in delivering palliative care, we try to work with the medical institutions to involve palliative care in their undergraduate curriculum for doctors. Here we work with the trainers. They then train the students in palliative care. We work with these stakeholders to help them build community engagement and help them mobilize volunteers. Here in Pallium, India, we create awareness among the public, get similar interest people together. They form a group. Like I told you, it's called link centers, and they take the ownership of taking the palliative care across the region. So we help in building communities also for our stakeholders. Like if people are interested to build a community in your area, we are happy to help you in that. And the 5th objective that we are focusing into is developing a pain-free hospital. This objective is in the budding state right now. Here, we try to develop a hospital wherein any patient that enters for any treatment is assessed or treated by the pain score that he or she has. The pain score is measured by a scale which ranges from 1 to 10, 10 being the highest. So any person entering a hospital will be assessed by the pain that he has, and then he'll be treated. So those those hospitals will be called pain-free hospitals. So we are planning to develop pain-free hospitals. We have done 2 in the till now. So we have 2 pain-free hospitals in India. This is the national presence that we have. So we have worked with NHM, state drug controllers of 25 states and 3 union territories in terms of training and facilitation. The training centers that we have catalyzed are, there are 5 training centers catalyzed by us. One being Trivandrum, TIPS, another being MNJ, Hyderabad. We have Telangana, we have GCRI, Ahmedabad, Gujarat. We have BM CHRC, Jaipur, and PSG Medical College, Coimbatore. These are the training centers which are catalyzed by us. Catalyzed in the sense we have helped them in end-to-end facilitation to develop the palliative care center, training center. We have done on-site foundation trainings in 11 sites. This means that the course that is happening here virtually, we have done it on-site at various states, like various institutions, in collaboration with various institutions. Like we are doing it right now virtually, we have done it on physically on-site. So we have done it for 11 sites. Like I told you before, we have 2 pain-free hospitals. We have developed 2 pain-free hospitals, one being in Uttarakhand and one being in Assam. Then we have done faculty development programs at 6 sites. We have catalyzed 72 sites in all over India till now. Hamrahi sites we have done in 27 sites. We have done Hamrahi project. Hamrahi is a project wherein we are working with APLI, APLI in the sense Australasian Palliative Link International, for mentoring palliative care centers across India. As of today, as mentioned, we have mentored, our APLI team has mentored 27 sites through this project. Hands-on training sites, as I had mentioned earlier, like we have 52 sites right now. So these 52 sites, we developed last year. This happened, the idea behind this was when once a person is completing the virtual training for hands-on experience, they are not getting any hands-on experience, and palliative care is is something that should be experienced, not theoretically learned. It should be experienced as well. So for those who are undergoing the virtual training, we have talked to 52 sites around India where you can go and get hands-on experience. So you can approach these centers, go for 5 days. It's usually 5 days. 5 days hands-on training. You can go and get exposure in their IP unit, OP unit. Go with them for the home care. So the list of these 52 sites will be shared by training team once you complete the your course. You can approach these centers directly and get the hands-on. There will be a small fees or something like that. It's as part of their rule. So you can go and get the hands-on exposure. Opioid access facility, we have till now we have helped 15 sites to get RMI. So directly Like we have helped them in end to end, starting from applying for RMI, all the documentation that they need, everything. We have done it this for this facilitation for 15 sites. So that's it. That's it from my end. uh, thank you. Thank you so much for listening to me. Anything
Thank you
else?
very much, Aarti. It has been quite extensive, and that much was needed. Very, very informative. Okay, well done, I would say, because this is what all of us need. Okay, and see, in each course, you'll have a group of people who have different aims and goals. So you've given something for everyone. Someone may just want to join an institution, someone may want to start an institution on their own. So, very good. And a couple of things what I want to add on or enlighten everyone in this is the CSR. Okay, that is a big important resource. Okay, and please, if anyone wants, try to tap in, and then if you could be able to help them, as you said, you are willing to help them, because CSR, every organization, it's 1 to 2% of theirs.
Yes.
So it is big money. Okay, don't let it go waste. And there are some, it's God's grace, a good opportunity I've had to know about these two from two companies. So that's why I would just like to bring it out. I'll give a small example. ONGC is such a well-known organization. Their CSR, one of the product education part, they have got a big organization set up online for Sanskrit. Okay, they have projects and curriculum which is excellent. Everyone can do it online. They've got variety video links. So like that, I'm just giving like bird's eye view on one element. So many CSR is available. So all of you, please try. And even the CSR, as I said, it's a big amount. If you could tap and use it, and they are willing, because they want, it is basically, it's for general development, is corporate social responsibility. That is what CSR means. So it is payback from that, from any company. So please try to use that. And the next important thing what I want to highlight is the audit tool. Okay, no audit tool is just us looking into our own practice and trying to see how can I improve. It is just self betterment. So not to be offended, it's not going to look into your practices, what is not right or something like that. Please don't ever take an idea on that. There's something called as an audit cycle, because it is practiced and done. So you do follow that tool, or sometimes you can make your own audit recipes, they are called. You see, make a format, do that, and then review it completely, and then you make changes. Okay, that's how the full cycle is complete. You first do an audit and then see, oh, these are the things not okay, I'm going to change this. Then do another cycle and then check. Then you try to rectify and has that improved my practice. So these are the two things I wanted to say, and everything was so informative and useful. And hope I would leave it open to all of them to either unmute and ask or type in the chat box, whichever they feel comfortable should be fine. Very, very informative and explanatory it was, Aarti. Thank you very much. It's given me a good support that we can come to you, and all four regions you've given. So whoever is needed can be approached, and we can comfortably move forward. That's the feeling I got.
Thank you so much, ma'am. Any questions? Anybody?
Someone has can the information about the hands-on experience be found on Palim India website? I think Aarti said it would be shared after.
Yes, it would be shared after the course is like on the completion of this course. Training team will be sharing the details of these sites with you. So
normally that's how it happens, because see, I'm just telling my experience. I did this in 2017. Even though like with whatever experience and things I had. But I said, whatever is the rule, I will follow that. So those days I did an in-house program. So that was a must. So that is when, so once it is done, then after that, the hands-on is always said, and especially as I was mentioning about morphine, that is part of the requisite.
Yes.
So you have said 52 sites is a good number.
Yes.
So that covers all over India. Is that right, Aarti?
Yes.
52 sites.
Only two states are remaining. I think Madhya Pradesh and one more. So
Okay, not bad. So if you're covering all the other states, that's a good thing. Shouldn't be more difficult thing. So somewhere access should be there, and then if you could go do that 5 days, and then, but there is again, as I said, there is some number of cases and things you do. There's a stipulated requisite for that. Once you do that, you get, it's like all complete. This and that together will make you in total eligible for moving forward.
yes, ma'am.
How many pediatric palliative care centers are there?
Here, I don't know about the rest of India. There are many, but there are few only. Actually, pediatric palliative care centers are few. Here in Trivandrum, we are running one. We have we are starting an OP at Pallium India on next month, and we have an OP running in Trivandrum Medical College. Otherwise, I need to check and get back to you for the exact number and name of the centers. I'll check and get back to you. Who was that?
That would be nice, because previously also somebody had asked about this. And from what I know, as I worked in Adayar, Chennai, they have a separate, that is, they have a pain and palliative care service, and they have some specialists who look into pediatric palliative care also. I would like to know if we have any research opportunities in Pallium India. Can you enlighten on that, please?
Yeah, we have a research department here, so I can share you the number of the concerned person. You can get in touch with them if if you can associate with the existing research programs. Otherwise, there is an institutional ethical committee, to whom you will have to submit your proposals and then get approval and work forward. So existing research, if you want to get in touch, know about that, I'll share the details of the research team. One is Priya Chembal. So I'll share the number.
That would be helpful, because you have said the right thing. Either if you want to join the team, they will already have a principal invigilator and stuff, so they can join that. Or if they want to do, as you said, new, then they will have to go through the full ethical committee and things. Next question is, I would like to know about research collaboration, either individual. Yes, so in that case, I think
We'll share the number of
Sri Priya.
we'll
Sri Priya, you pass on the information and we'll ask. Let me check who was that.
Thank you so much.
Dr. Tribani. Okay.
Thank you.
Akshita also, Dr. Akshita and
that's all. So maybe she could
yes,
share it.
Dr. Triveni here. I would like to know that whether on individual capacity or anything we can, in your startup, which we can do any more research, mainly the care part improvement.
Yes. No, see, all these information, that's what you could talk to the team and see if you could join. First, I would recommend you join in some existing project, so that that will give you an idea, and always data and information will be beneficial for them too. So see if you could do, and then maybe then you could go on and do something on your own too.
Okay.
We'll ask Sri Priya to share those details to both of you.
Okay. Thank you, ma'am.
Welcome.
Any other questions?
Yeah, hi. I also want to know if Pallium India has collaborations outside of India, like other countries. Especially Western countries have, I think, established palliative care. I think more than our country. But do we have any connections with other resources or any other doctors who actually are, like, say, faculty or are associated with Pallium India?
There are many. There are many. We are a member of IAHPC, APHN, and all. So we have many connections. Usually, most of the connections are abroad only, international connections only. We have a connection with Queen's University. So they are helping us with the curriculum development and for global fellowship and all in palliative care. So we are recently only we have signed an MOU with them. We have connection with Iowa University. So yearly they send us students of their students for a cultural immersion program. So we do have connections. Yeah.
If I'm not wrong, they have some connection with Anderson University also, I think, isn't it?
Yeah. Yeah.
I vaguely remember. Yes, they have quite a lot of connections, and palliative care is something all over the globe. There are many. It's not up to where it needs to be. Even WHO, if you read, that's what WHO also says. Globally, everyone is aiming to get better in that, and there are many facilities. And then Pallium India has got great links with almost many international communities. Quite a lot of stuff from in US they have links with. Is that right, Aarti?
Yes, yes, ma'am. There are many. I can't name everybody. These are the names.
I know. That's what. From what I to know, they've got a lot of links with US. From what I remember.
You can refer our website also. You'll see most of the detail. Every detail is there in our website, so you'll see these names there as well.
See, regarding the website, I would also ask you exactly what Pallium India itself will have all the information, or Cochin Pallium. Is there anything specific where to get more information?
Palliumindia.org, that's the website, that's Pallium India's website. We'll have everything there. So even if you want, there is a directory also for palliative care centers. So you were asking about the pediatric palliative care, no? You will get that information there.
Okay,
there is
yeah, thank you so much. Actually, I'm very
I
much
was also
yeah, and I've just graduated just an MBBS, and I know that I think in India, in the first class, we learned that now there are MD and DNB programs in palliative. But usually the pathway to come into palliative is you do internal medicine or from any field, and then later we come into palliative. So I think I'm very happy that we have options now to, join as a palliative care resident. And that's good. Because also I think in my MBBS, I didn't get trained in palliative. We had oncology postings, but not palliative. So this course has been really good. So thank you so much, Pallium India.
Definitely, dear. Your thought, no, knowing a little bit more internal medicine will really be very good, because see, doing this after MBBS also, if there's an opportunity, fine. But if you get to do something else and do this, that will also be good. See, it's a super specialty, I would say.
Yeah.
So to excel in that, you need a little bit more knowledge than your MBBS, because just see, no end to knowledge. Okay, and knowledge will never go waste any day. So don't ever think if you do some other specialization and then come back, that is also good. You do this also, that's also good. So basically, it's a subspecialty or super specialty, I would say. Not sub, I would say a super specialty covering a lot. So that is what it is, and there are many openings. And Pallium India, from point of view of palliative care and teaching, bringing that, there's no match. It's a good and golden opportunity. God's blessing to be able to get into their part of their team or into their system. And good that if she says that Pallium ORG should be able to, the list of centers, if it's there, will come handy for you anytime, even for yourself or when you want to refer someone. Go ahead.
I shall ask Sri Priya to share the the link for the directory. So you can directly go in, and state-wise you can see which all state, which all centers are there in each state, what all services they provide for CA, non-CA, specialized care, like pediatrics will come under specialized care. So you can see everything is mentioned in the website itself. So we are developing that. So we'll be updating, like we are regularly checking with these sites for, if the information, keeping the information updated. So, otherwise, you can get in touch with any of our regional coordinators. They'll be knowing more about these centers.
Definitely, that was helpful. That getting to know that there are 4 regional coordinators who can be approached for that particular region. That was another useful information. Anybody else wants to ask anything? Please go ahead. Okay, in that case, is Shri Priya around, or what is?
Yeah, ma'am. Yes, ma'am, I'm well here only. Just because of some health issues, I had to stay at the side.
No problem. No
I was here
problem, dear.
only. So,
No, that's all. So if everyone feels like information, as I said, no, just to share the details about the research information to whoever was interested, and then the directory, I would say, I would also love to get that, Sri Priya, because plenty of people keep asking me on different regions and things.
already
So
shared
that
in
will
the
be
group,
very,
ma'am.
very handy for me. So please do that.
Thank you.
Radha ma'am, is it now the
If,
ball is my court, or you
pardon me?
have? I was just asking, confirming whether the ball is in now my court, because I
Yes.
usually have to. Thank you, Arathy. Thank you for joining in, because me and Arathy work in the same hall, so to say, in our organization, and I regularly see her running here and there. She's a professional multitasker, I should say, and still you found out time to join us, because I didn't have. She's one of those faculties whom I don't have to remind every time. Once I say it, she's all set and go, and I believe that she had done her job beautifully today as well as expected. And regarding the materials, I have already shared the link to access the directory and the telehealth helpline numbers and the contact numbers of the regional coordinators in the group. Please do make use of those information. Regarding the research opportunities, the participants who have asked have got the number of the research department representative in their private message by now. So hoping that this was a very enlightening session with a different perspective for all. This is Sri Priya along with Dr. Arathy Venkadeshan and Ms. Arathy Venukumar signing off from the Tips Eco Hub. See you in the next session with another very interesting topic and then one of the experienced faculties. Stay tuned. Till then, everyone, take care, be happy. Bye-bye.
Thank you.
Bye.
Thank you.